In this video, I will discuss the hospital-acquired infection called a CLABSI, and that stands for a central line associated bloodstream infection. Now, over the next couple of weeks, I'm going to do a series on all the top hospital-acquired infections. So make sure you subscribe to my YouTube channel to stay up to date when these courses go live. Now, about 1 in 10 hospitalized patients will experience a medical error from a hospital-acquired condition. So if you receive a medical condition or a complication during your hospital today, that's considered a hospital-acquired infection. So, for example, these infections were not present when you were admitted into the hospital. It's something you acquired while you are in the hospital. But you and your medical team and your loved ones can prevent these infections from happening to you. Now, a central line is different from an IV, as a CLABSI assesses a major vein that is close to your heart, and that placement can be like in your neck, your chest, or your groin. And they could remain in place for weeks or months. And this type of infection occurs when germs get into your bloodstream through that central line. An example of a central line is a PICC line. And this is common with cancer patients. Some cancer patients used to get a PICC line inserted so that every time they go to the doctor for chemo treatment, they're not having to continuously being stuck. So I'm going to give you some tips that you and your medical team and your loved ones can do to assist in lowering your risk of getting this type of infection. Of course, always wash your hands. Remove the catheters when they're no longer needed. Ask the doctor regularly if they need to be removed or if they are absolutely necessary. And always research the hospital on their CLABSI rates, like through the Leapfrog group that I've spoken about in another online course, or through CMS Hospital Compare. Some symptoms to look for. If you notice any unusual symptoms, please, please, please always notify your medical team. But some of these symptoms are redness, pain, or swelling at that central line site. Any pain or tenderness that's along where the central line, if it's inserted through here, if there's any pain through that, where the line is there drainage from your skin? You have sudden fever or chills? And pay attention to the bandage area around it. If the bandage comes off or if it gets wet or dirty, just tell your healthcare worker right away. And don't get the central line insertion site wet. I hope this was helpful, and thank you for listening today. Again, make sure you subscribe to my YouTube channel, share, like, comment to stay up to date when the next course goes live. Thanks, and have a great day.